Okay, let's just give it one more minute and then I guess Andy Akundi, I'll let you can make the call when we kick off,
Oh,
okay?
I'll do the official start. Got it.
Yeah.
Yeah. Hello, everyone. We're just waiting another minute here. We had a lot of registrants, so we give another 30 seconds or so. All right. James, I'll let you take it away.
All right, perfect. Well, welcome in everyone. Happy Thursday, June 12th. Thank you all for being here. This is our final review of the recommendations for our sustainable plan for CHWs. I am just here to do the housekeeping pieces, but I'll move on to that. We're in a Zoom meeting. We have been doing these for, gosh, 5 years now, but just in case you need an update, please remember to keep yourselves muted throughout the presentations. We have a lot of discussion, a lot of topics that we want to get through. It just helps cut down on noise and everything. There will be moments for questions, and we'll also have some breakout rooms later in the session. Obviously, please unmute yourselves at that time. We'd love to talk with you at that point. But if you have any questions, concerns, feel free to put stuff into the chat. I will be fielding that along with my colleagues at the Alliance here. Captions are also available. You can activate those for yourself personally if you need that as an assistance. And of course, the meeting is being recorded, which is why we appreciate that you keep your mics muted. This makes it a little bit easier when we're sharing this after the fact. And we will be sharing this recording with everyone who's registered and attended after the fact if there's pieces that you want to review or look back on. And then I will turn it over with much gratitude to Annie Akundi to kick things off for us.
Excellent. Well, very excited. There's a lot, and I mean a lot to review today. So we're very excited at the Alliance to welcome you to this meeting. To kick things off, and James, you can go to the next slide. We want to ground ourselves in two specific areas of interest to us at the Alliance. So I'll just read this. The Minnesota Community Health Worker Alliance acknowledges that the land on which we live and work is the ancestral and current homeland of Indigenous peoples who've stewarded it for centuries. But we acknowledge that a land acknowledgement alone is not enough. It's merely a starting point. We must ask ourselves, how do we take meaningful action to support Indigenous communities? Some suggestions are donate time and or money to Indigenous organizations, support Indigenous-led grassroots change movements and campaigns, and to encourage others to do so. And importantly, learn more about the ways governments and individuals are actively working to return land to Indigenous communities. Next slide. We also want to ground ourselves in the definition of a community health worker. Many on this call, as I'm looking through the list, should probably have this memorized by now, but we want to state it so that we have this common grounding on understanding what we're talking about here today. The first definition is from the APHA. It says a CHW is a frontline public health worker who is trusted, a trusted member and or has an unusually close understanding of the community they serve. This trusting relationship enables the worker to serve as a liaison link or intermediary between health, social services, and the community to facilitate access to services and improve the quality and cultural competency of service delivery. The Minnesota Community Health Worker Alliance, we speak in terms of CHWs coming directly from the communities that they serve. This builds trust and vital relationships. This trusting relationship enables CHWs to be effective links between their own communities and systems of care. So now that we've got that grounding, I'll briefly walk through the agenda so we know what to expect. Um, so one of the first things we're going to do, and I love this, is start off with the CHW impact story. Carrie has been gracious enough from Neighborhood Health Source to share a story. Next, we'll go into the background and review of the planning process. This is an active working groups and movement, if you will, involving a lot of different stakeholders in the community. So it's important to walk through what led us to today. Then we'll introduce this is the fun part, the sustainability plan. We've had a variety of work groups working on, filled with many different people over the past couple of months, trying to help us to develop a plan that will support the CHW infrastructure across the state. And we've got a series of strategies and activities that are related to some of those recommendations that'll be shared. We'll walk through the measurement plan. Rachel will do that. We also have our logic model. Then we'll have breakout rooms. As always, we want to get feedback on this work that we're doing before it becomes published, for all of us to use across the state. And then there'll be a review and a discussion. We'll come back together and then we'll wrap up with some next steps as well. So I'm going to now turn it over to Carrie to share her story.
Well, thank you, Anne. First of all, I want to thank you guys for inviting me here today. I really appreciate it. Today, I'm pleased to share the progress of one of our participants at the Neighborhood Health Source. When she initially connected with us, she was experiencing homelessness and facing significant challenges navigating the housing system. Although she had a professional statement in need already on file with Hennepin County and was working with a housing organization, she did remain unhoused. Recognizing that I wasn't fully familiar with every aspect of the housing process, I assured her that I would do my best to support her journey. As part of the effort, I referred her to Community Development Center, which is a housing stabilization service provider that we've partnered with since January. The organization has been instrumental in walking alongside of us to secure housing solutions for our clients. The participant later expressed her deep gratitude for the referral and the support she received. She has since transitioned from homelessness into temporary housing, now has an arms worker, and is enrolled in peer support in our clinic with my colleague Samantha Yurdahl. Together, we are focusing on skill development to support her recovery journey. We also, she's also shared her hopes of regaining custody of her son, which people in our clinic have some experience with. So we're helping her in that area as well. Community Development Center has informed her that they are actively seeking a vendor to accept her housing stabilization services voucher with expectations of securing permanent housing within the next 30 days. The milestone is particularly meaningful as she is the first participant we have successfully housed, even if only temporary, through our clinic's partnership efforts. It is a moment of pride not only for her, but for all of us on the opioid team. Helping individuals access vital resources and empowering them to take steps towards recovery is central to the work that we do. And as a certified peer recovery specialist and recovery navigator under the umbrella of community health work, supporting participants in this way continues to be deeply rewarding. It not only continues their personal progress, but it also enhances my own recovery journey and expands my knowledge of programs available to those that we serve. It allows me to offer these programs to people who are in need. Through my own experience, I know of programs, but as I work in this field, I get to grow and experience things myself and learn more every day and get to help a lot of people in the community that we serve. So thank you for allowing me to share this powerful story of resilience and hope.
Wow. Thank you so much for sharing that story. Um, this makes me think we should start and end every meeting that we do at the Alliance with a CHW story. There are many out there, and just working in public health, we often don't always take the time to kind of gather, document. That was amazing. Thank you,
Thank
Carrie,
you.
for
It's
your
important for me, like I mean, I have my own story of resilience and hope and things like that. And that's what brought me to this world. I've been in recovery now for almost 2 years. And so like, that's what led me to it. And as I get to work with people who are experiencing the same story, it I get to learn more about the programs, and it allows me to help people not only from my own experience, but then I get to grow and develop and share more with the people that I serve.
Well, I know everyone on this call has an interest, obviously, in the work that you do specifically, replicated across the entire state. I know at the Alliance, we exist only to serve people like you, and ourselves, right? And many on our team are CHWs, and so we're all part of the same family, but we've got lots of allies on the call too. So really, this meeting in many ways is for you. And for other CHWs across the state to tell us if this meets their needs when it comes to their work across the state and going forward. So thank you so much for sharing. Anne, I'll turn it over to you.
Okay, thanks, Anne. My role is to talk about the background and review of the process. So I will start with the story of the Minnesota CHW Alliance, which has been around many years as a really small nonprofit doing CHW field building. So some of the results of this field building, which came out of very broad-based processes like the one you're engaged in right now, which has been a value of the Alliance, is the CHW scope of practice, the certificate program and the certificate as a credential, the reimbursement for CHW services, which we know becomes a big part of this plan, starting a CHW registry, a leadership institute, which has graduated 4 classes and in its 5th cohort. We've held statewide conferences, and recently we funded 4 CHW demonstration grants. So all of these are building blocks of the field, and many of the issues raised in the planning process have been brought to the Alliance, but as a tiny nonprofit, we were limited. That's the beauty of our new partnership with the Minnesota Department of Health. We've always been a partner with MDH, but with the new partnership in this planning process, we're creating a roadmap to expand services and build better health for individuals and communities across Minnesota. And we are close to implementation. So that brings us to the process. And if you could go to the next stage, yeah, thanks, James. This process began with the creation of the environmental scan, and that was largely Laura Turek's work. She completed it on a really quick timeline, and it was used to kick off our meeting in March when we brought stakeholders together to see the environmental scan and begin this process. In March through April, many of you were involved in our stakeholder work groups, where we worked to develop the recommendations that became the foundation of this plan. In May, we sent those recommendations back to you for feedback. And then we used that feedback to create the drafts that you're going to be looking at today of a sustainable plan, a logic model, and a measurement plan. After today, we'll be making the final plan, measurement plan, logic model, and then implementation will begin next month in July of 2025. So your participation in this process, the experience, the knowledge, and the hard work that all of you brought to it is priceless. We had over 105 people involved in the process, 31 CHWs, and that's really important because I believe that the work Minnesota has done in this field has held up so well because we always involve CHWs and work from the philosophy of nothing about us without us. So 105 people, 31 CHWs. The success of this plan belongs to all of us. And your hard work has given us a strong foundation for implementation and success. And those will be our next steps. So I will turn this back to Anne to go forward.
Thanks, Anne. This is Kristen. I think I'm jumping in here to introduce the sustainability plan. Did I get that right?
Yes, yep.
Great. Thank you. Hi, everyone. I'm Kristen Godfrey-Walters. I use she, her pronouns, and I work with community health worker initiatives and community engagement at the Minnesota Department of Health, where we foster collaboration and coordination of CHW initiatives between state and community partners to strengthen the community health worker workforce. And thank you to Anne for giving an overview of the collaboration and partnership between MDH and the Alliance, and then all of you as CHWs and key partners across industries, settings, employers, and communities that that CHWs touch across the state for the development of the sustainable plan. So in this part of the agenda, we're going to highlight the key recommendations, the goals, the strategies, the activities that came out of the work group convenings and were drafted and distributed by the Alliance in a sustainable plan document. So you all should have received that, a link to that by email. And if someone could maybe drop it in the chat as well, that would be great. So the sustainable plan document has high-level goals. So you can see on the left side of this slide that align those goals represent the work areas of the work groups, which includes community health worker training and workforce development, promoting evidence-based models and CHW services, sustainable funding and policy, and then data collection and evaluation. And so in the plan document, there's 4 key strategies are identified in each goal. Under each goal. So you can see those are numbered. For example, the first one is community health worker training and workforce development. And then there's 4 recommendations, 1A, 1B, 1C, and 1D, or excuse me, those are the key strategies. And then there's activities under each of those goals. So a lead from each of the work groups will provide a high-level overview of the strategies and activities, and you can refer to the plan document that I think Fanny put in the chat. Thanks, Fanny, that you can refer to more details. Okay, next slide. Okay, so I think this is Sustainable Funding and Policy Workgroup recommendations, and I think I'm passing this off to Anne.
Yes, very excited. Wish we could spend the rest of this meeting exclusively focused on this topic, but there's been so much great work. I know that this particular work group, we can't hog for those of you who are part of this work group, we know we can't hog the show, but there's a lot of work here and a lot to say. So for my presentation, I put this slide together, just initially had the high level points. I'll start there. As Kristen mentioned, there's 4 different strategies here under sustainable funding and policy. So very high level, I'll touch on just what each overall strategy is, and then briefly state the core sort of activities or set of activities. So you get a flavor for what the work group really leaned into discussing and would like to advance specifically. So when it comes to strategy 3A, which is in the full plan and fleshed out, this is around advocating for full implementation for a broad range of CHW services. So we know CHWs are trained to do what CHWs do across the country. And it's a fully fleshed out role. And in the state of Minnesota, we have a certificate program. And so we'd like to just see reimbursement aligning perfectly and in sync with the full scope of what a CHW can do. But in this particular area, some core strategies here or activities are to tie CHW services to Medicare, Medicaid core benefits, expand billable services, remove initiating provider visit requirement, support Medicaid enrollment for CBOs or an alternative to establish an umbrella organization or organizations plural to bill on behalf of smaller CBOs. And then of course, maximizing Medicaid and MCO reimbursement. And so that multiple areas, these are big activities of advocacy, and several would require engagement with a variety of other stakeholders as well to really carry this out to success. But these are the recommendations under that strategy. For strategy 3B, establish and streamline use of standardized billing, including use of codes and reimbursement. Actually, much in here is in alignment with a lot of our physician partners at the Alliance across the state. So simplifying our billing infrastructure, streamline payment timelines. So quite a bit of administrative activity improvement to work on. Designate CHW billing champions. And I'll flesh that out further, specifically having champions within payer and provider systems to co-develop streamlined billing pathways. It can be very confusing all around the billing process. Provide training and technical assistance to employers on billing and reimbursement processes. This can be co-opted, or not co-opted, but integrated with other work. For example, the Alliance does around employer support related to the CHW role, scope of practice, organizational readiness, but really to make that sustainable, any CHW program, the billing or funding resources are critical. The next activity, promoting the development of community care hubs, hosting cross-sector training sessions. That one's an interesting one, just to flesh out a bit to align with interpretation of CHW billing codes, improving implementation consistency, reducing errors in claim submissions. There's just a lot of work here, some proposed recommendations too. And I think this is actually a separate activity that a little error there, but the last activity for this one is to work with DHS and certificate schools to speed up the enrollment process. For strategy 3C, so this is really exercising and collaborating to figure out different ways to secure funding for CHW positions through government grants and resources. But to be successful in here, some core activities included providing grant funding and technical assistance support. So CHWs themselves understand program development, billing, data collection, and healthcare navigation. Use grants for infrastructure development. So this is applying public health and philanthropic grants to continue to build administrative and programmatic capacity. Pilot pay for performance initiatives. That was a fun topic that we discussed. So launching the demonstration projects and tying private or public investments potentially to CHW related outcomes. And then of course, coordinating with county and state resources. And then for the last strategy, develop policies that support CHW integration and sustainability. So a lot of specific recommendations in this bucket. Ensuring this, most importantly, I would say ensuring that the CHW voice and leadership continues to be embedded as part of the development of the profession. Explore CHW certificate internships, internship billing. Is there a I'll flesh that out too. Is there a mechanism we can create to reimburse services delivered by CHWs providing eligible billing services during a required internship? That came up. Set minimum reimbursement standards. This is number one. This could be potentially just number one for the group. Let's just make sure that the pay is actually livable and can help CHWs thrive. And there were some specific dollar amounts highly recommended. Of course, engaging policymakers overall, formalizing stakeholder feedback. So this involves establishing another work group or some sort of interagency council to track implementation barriers more closely between agencies, advancing legislative advocacy, improving communication with relationships with state agencies. So continuing to strengthen our relationship with the health department, but really digging in deeper with DHS, Department of Labor, and others. And then, of course, this one was a fun one too. Create a CHW liaison role within DHS for CHW billing. A lot of support for that one or discussion around that to really help the agency understand really the full scope of what a CHW actually does, so that the administrative work, administrative policies that are tied to funding align with that work. So yeah, that's what I have for this group. Hopefully we're still on time, and I'll turn it over to I think is it Vanyi? You've got the next group, I think.
Yes, training and workforce development. Thank you, Anne. So these are some of the recommendations that came out of our work groups. Anne mentioned probably some of these here. What we did find is that a lot of the information was cross-referenced or mentioned in multiple work groups as well. So for sustainable funding, we heard that organizations rely on grant funding sources for CHW wages. And again, that there are inequitable CHW wages. Organizations have structural changes that result in some labor and programming cuts, and then federal funding cuts without advance notice or time to plan, which we're seeing a lot of today. For billing and reimbursement, there's low or no reimbursement for CHW services, low reimbursement for those services that are covered. And then, as Anne mentioned as well, the burdensome billing process. So we want to see simplified billing, but we also want to see support and navigation for that billing process, but then also training CHWs on billing and reimbursement came up in the work group as well. Education and training, it was mentioned that we should have a state recognized CHW career ladder and stackable credentials to recognize and to help CHWs to stay within the CHW profession. And then also the need for improvement with our CHW registry, which is in process right now. The other thing that was mentioned was more roles for CHWs in research. So again, we heard a lot from each of the work groups, and a lot of the information was cross-referenced throughout those groups as well. And we can go to the next slide. I'll pass it to Kristen.
Thanks, Vanyi. Okay, so I was a co-lead with Angela Fields on the evidence-based models and CHW services work group. And the 4 key strategies that were outlined are to expand community awareness of community health workers and results, implementing and evaluating evidence-based and community-driven community health worker models, promoting community health worker integration into healthcare teams and community-based organizations, and then documenting and disseminating best practices and success stories. So those are the high-level strategies, and then under each strategy, I'll talk a little bit about the activities. So expanding community awareness of community health workers and results. Again, I think this was brought up in all of the different work groups in many different ways. Really needing to continue to have more statewide campaigns to raise awareness of the community health worker role, having advocacy training for community health workers to empower community health workers and allies to tell the stories and advocate for community health worker roles, and then highlighting the return on investment or capturing cost savings and really being able to translate that for funders and policymakers. Under 2B, implementing evidence-based and community-driven models. So this is looking at implementing and expanding the use of models such as Pathways Community Hubs, Impact, and other team-based care models, as well as encouraging and promoting models that use braided funding, adapt to local needs or in local environments such as rural versus urban, and then really documenting and sharing more of the community-driven and promising practice models. So being able to collect and publish success stories of these successes and of these models, and then to be able to expand those as well when they're documented. Under 2C, there's quite a few activities around promoting community health worker integration into healthcare teams and community organizations. So there was a lot around, which we also heard in the scan, organizational readiness tools and stakeholder orientation, really creating awareness and understanding of community health worker roles, to prevent misutilization of roles, as well as to really build on the great work that community health workers can do. Promoting that interdisciplinary team integration. So again, how does a community health worker work on a team with a social worker or a nurse or other roles to really respect and foster the community health worker role. Incentivizing community health worker job titles. So again, utilizing the community health worker role and title. Right now, there's many titles and roles for community health workers, and that can make it hard to create this message of awareness and understanding, as well as to be able to track those roles. For rural community health workers, there were some activities around strategies for recruiting and retaining community health workers in rural and underserved areas, and having things like mileage reimbursements, housing support, other things to facilitate community health workers to be able to work in those areas. Structuring schedules and documentation to recognize the relationship-based way that community health workers work, and to be able to document that and allow for that the time that's needed. And then a lot around both community health worker and organizational peer learning, networking, resource sharing across organizations and across community health workers at the local level. And then 2D, document and disseminate the best practices and success stories. So 2B is really around, understanding, documenting those stories, and then sharing them. So publishing community health worker best practices, having annual community health worker model innovation summits were some of the activities that the work group came up with. All right, I think I've covered everything under the evidence-based models, and I will pass it off to Rachel, I believe.
Yes, hi, sorry, I couldn't find my button. We got too many screens open. So my name is Rachel Stahl. I'm the education manager at the Minnesota Community Health Worker Alliance, and I co-led the data and evaluation work group with Laura Tarek from MDH. And so every group so far has mentioned that we need to do a better job of gathering data and evaluating that data all in one place for the state of Minnesota. So our work group was in charge of really drilling down into what does that mean? And so there's going to be, I'm going to talk about two pieces of this. The first is just this slide is a summary of what our work group sort of came up with as things that are needed in terms of data and evaluation. And then the next few slides is going to dig down deep into the measurement plan. So the first thing that our group talked about was creating a statewide measurement plan. So defining the standardized metrics. What are we measuring? Establishing the baseline data, and creating a system for regular updates. This is kind of going to be foundational for how we are going to do all of the work going forward, because we can't promote CHWs if we don't have a place where we put all the information and we can all access it. So we're working to get all of the data that we already have, putting it all in one place and making it usable for you guys all across the state to use to grow your programs, advocate for new programs, understand how CHWs are paid and how they can do their best work. So in order to do that, we have to enhance our data infrastructure. So we need to have a data infrastructure for monitoring and evaluating the CHW workforce statewide. This means investing in IT and data systems. So I just want to call out that this is a statewide CHW sustainability plan. We've mentioned this a few times, that Minnesota Department of Health and the Alliance, the Minnesota Community Health Worker Alliance, have worked together to bring you guys all together to create this plan. And this is a plan for all of us. So it's not just work that we are going to do at the Alliance, and it's not just work being done at the Minnesota Department of Health, but we're hoping to create a structure and give tools so that each of us on this call and everyone across the state who cares about CHWs can plug into this plan. So one of the things that we want to do in terms of data and evaluation is to make sure that there is a landing place for folks to put their data. So the data infrastructure, a lot of that is going to be housed at the Alliance. Some will be housed at MDH, but we want to create systems where if you guys in your programs across the state are collecting information, we want to give you toolkits and guidance on what information everyone else is collecting so that we can compare apples to apples. And we also want a place where all that data can land and then be seen by others. And that is a pretty big investment in IT and data systems. We also want to support CHWs in conducting evaluation and research on our own workforce and on our own impact. We know that decision makers and people in power are moved by data, but they're also moved by stories. And that's one of the reasons that we had Carrie Ann come and ground us in this work with a CHW success story. We know that all of us who have done this work and have seen this work done deeply know how impactful CHW work is, but we need to find ways for CHWs to be empowered in evaluating our own workforce. And that's something we want to move into. And so that means establishing and funding CHW evaluator positions and helping train CHWs to evaluate our own work and our own profession and our own outcomes, because I think CHWs bring a perspective that is vital in the evaluation space. And then we also want to develop data sharing protocols so that we all can share data in a way that is safe for those folks we serve, and also is, again, comparing apples to apples. Lastly, we want to ensure community engagement in evaluation. So we want CHWs and communities to be part of creating and interpreting evaluation metrics, and we want to co-create tools with CHWs. So that's the sort of the work group summary, and then we're going to move on specifically to the measurement plan. Keep on going, James. Thank you. All right. So the purpose of the measurement plan is to strengthen the community health worker infrastructure in Minnesota through data evaluation and measurement, track growth, success, and health improvements. And the audience is first and foremost CHWs. We want to be for CHWs and by CHWs, CHWs employers, state agencies, policymakers, funders, and CHW educators. We want this to be for everyone. And I think most folks interested in our work fit in those buckets. So I'll start out with just a little bit of an overview of our timeline. Earlier, Ann Gainey talked about the timeline for this group and noted that the environmental scan was done in December. And we would like to have that put on a webpage at the Alliance in a place that is accessible. Those documents are available. MDH has those documents posted, so we would have links to those documents, making sure that they're on our webpage and accessible to all. So that'll happen this month. And then we are hoping to have a statewide CHW survey in September 2025. There have been some references to the Community Health Worker Registry at the Alliance. And I would love it if James or maybe Sam can stick in the chat if there's any CHWs on the call. We want to make sure that we get everyone in the CHW registry, and that that registry is where we're going to launch this survey. So if you are a CHW, or if you have CHWs that you work with, we would love everyone to make sure that they're part of our registry so they can be part of that statewide CHW survey. In October this year, we would like to send out a statewide employer survey, and we're going to ask similar questions in those two surveys, but from different perspectives, and then we can compare and contrast. A lot of the questions we'll be asking in those surveys are from the Common Indicators project that is nationwide, so that way we can start collecting data that can be shared across states throughout the entire state of Minnesota, and then across the country with these common indicators of CHWs. I referenced this a little bit. We want to create toolkits for different stakeholder groups of what kind of data could be collected sort of like internally in a health system, what kind of data can be collected and how that can be published and shared so that we can all collect the same data across the state of Minnesota. So we're hoping to draft those toolkits towards the end of the year. And then we're going to move towards getting a data dashboard online in 2026. Next slide. So first and foremost, what do we want to measure? So that's a big question, and is sort of foundational, right? So these top lines are what we think is most important to measure in our measurement plan. So what patient and participant outcomes can CHWs achieve? So we want to measure things like increased empowerment for participants of CHW programs, increased social support, improved self-reported health status for participants in CHW programs, treatment plan completion, and shifting care from emergency and disease-centered spend to primary care and preventative centered. What can CHWs do for patients and for participants in CHW program? The next big question we want to answer is, are community health workers working under the conditions required for our work to be effective? So that includes living wage with benefits, supportive and reflective supervisions, opportunities for career advancement, And that was referenced in the workforce development group too. We want to make sure that community health workers can continue to advance in their career and can have the career they want that is sustainable. And then we really want to see genuine integration into care teams. That was mentioned by another group as well. Zooming out a little bit, what policies can the state of Minnesota enact to strengthen the CHW workforce? So community health worker definition and statute, 10 core roles included in scope of practice, sustainable funding sources, and meaningful integration into our systems. And then the last thing we want to collect, which might seem, to when I first read this, it seemed like maybe in the wrong order, but we always think about the numbers, right? So how many CHWs are working in Minnesota, how many have completed their certificate, things like that. But we really want to show that as what does it take to achieve the efforts that we've shown have been achieved. So that includes the number of CHWs working in Minnesota, number of CHWs enrolled in and completing the CHW certificate program, what kind of communities are served by CHWs. So that would be looking at county, looking at both demographic data, geographic data, those kinds of things to determine communities, how many individuals are served by CHWs, and digging deep into those specifics too. And then number of CHW employers in the state and registered apprenticeship sites in the state. Next slide. So those were the measures. So then the next question is, how are we going to get to those things? How are we going to measure them? So we have sort of 3 buckets here. We have data that already exists. A lot of this data is data that Laura used to create the environmental scan that we would need to just sort of have a cadence for collecting on a regular basis and updating and publishing. So we have CHW certificate holder data that's from the Office of Higher Education. We have deed estimates of CHW labor, DHS data, which includes CHW reimbursement claims, number of CHWs enrolled to bill, and then local public health annual survey. We also want to look at data that already exists, but could be enhanced to be more specific to CHWs, or just a better data collection strategy. So the first example of that is the Minnesota MNCHUA CHW registry. Sam and James, our communications team at the Alliance, have been working really, really hard to get the registry to be more user-friendly and have a greater impact, and getting more CHWs into that registry. So stay tuned. The CHW registry is going to continue to get better and better. And we will use that as a way to gather CHWs together, and also to have data about the workforce. We want to add additional questions to the Minnesota Hospital Association annual employment survey. And then again, we want to promote the collection of the CHW common indicators by employers, and then have a place for those, for that information to land. We also want to talk about new data collection methods. Some of those I've already referenced. So the annual community health worker survey and the annual employer survey. And then those toolkits, recommendations for stakeholders to measure CHW impact by setting. So again, giving the tools to different kinds of settings for how we think they can measure CHW impact, and then finding ways to collect all that information. So the link that was shared earlier that has all of the documents for this meeting, it has that measurement plan outline document for you to look at. So feel free to continue to check that out. We are continuing to work on fleshing it out, and we'll be publishing our final document in the coming months. And I think next is Laura with the logic model.
Awesome. Rachel, great job. Wow, you guys, there is a lot of good information that came from this work group process. My task, next slide, James. Thank you. My task is to try to put this into a logic model that we use in public health space. Many of you are very familiar with logic models. It's just a way to be super specific and very orderly about what strategies you're using to get your outcomes you're hoping for. So if we have a lot of people across the state working on this, and this is what we would consider like a collective impact way to approach it. So we have everybody agreeing on where we're trying to go. We're agreeing on the best methods to get there. And then everybody's kind of pitching in to be able to contribute in different ways. And a logic model is a way to make sure that you can see yourself in the work. So which strategy and which activity do you do in your role in the community, or your role at the state, or your role at the Alliance? And then how does that contribute and build up to the big goal of having improved health for all those community members in our state? So the collective impact model we lay out, it gives us common agenda, shared measurement, which Rachel just explained so well, mutually reinforcing activities, which means we're not working against each other by accident, continuous communication, and that's what we're hoping some of the data will help us with, as we see that is something people can all access frequently with the most up-to-date as we can get it, and then working across the community through groups like the Alliance and their learning circles and their supervisor roundtables and any legislatively aligned work. We want to make sure that everybody can see the same picture and be working towards the same goal and feel good about it. So next slide. So we're going to use it as a roadmap. It's going to be something that is on a website. Probably we'll have it on MDH, or we'll have it at the MNSHWA site, easily accessible. We've had it in different forms, and we'll show you a couple. As Rachel was saying on that link with the Alliance, you can see this is one of the documents you can download to look at the draft of it. And then we have a draft of an older one from 2022 on our CHWI website, the Minnesota Department of Health website, which we put in the chat as well. So you can compare and contrast to where we started and where we're headed. And again, a lot of people use terms like objectives, milestones, outcomes. There's a lot of different ways to bucket the work. And so the terms are not as important, but we do want to share a common language around them. So this logic model is what we're trying to say, what's a goal and what's an objective and what's a strategy and what's an activity and how those are different, because that does help us know how to measure. And for people who are out in the community who don't do evaluation 24/7, some of these things feel more complicated or hard to access. And so if we can share the logic model widely and start to reference it more frequently than once every couple years, we'll use it regularly, and it will become more common for your just to be able to access the information. So if we do that, we'll see some good outcomes, and we'll be able to stop and pivot if we aren't seeing the outcomes we're hoping for. So the logic model is, again, a link you can peek at. And then if we go next slide, James. This is the 2022 one, the one that's on the MDH website currently. And you can see we have strategies around networking and continuing education and career development, supporting evidence-based models, evaluation, and communication and sustainability. So those are the strategies, kind of the buckets of work. And then there's activities that go with each of those that we've been working toward. And then there's long-term outcomes we're hoping will occur. And we need to be able to measure to see if that's the case. So next slide. This is what we're shifting towards. So you'll see a lot is familiar, a lot looks the same, but we're just trying to shift it a little bit to be able to measure more distinctly and more with a little accountability for all of us as a team to be able to measure what we're headed for as far as numbers. And so we put some deadlines and some numbers to the objectives, and we added a few goals, or I'm sorry, a few verbs to our goals to make sure that we're moving actively toward these things. And then the outcomes, very similar. And when we dig into the bigger logic model, you can see each activity that might build up toward one of those objectives. So for example, by June 2028, we want to increase the number of students enrolled in and completing a CHW certificate program by 10%. So every year between now and 2028, we want to see growth. And there are activities like tabling, promotion, presentations, outreach that people can quantify what they're doing. And then in that first year, if we're not seeing a 10% increase, we can change, increase, decrease what we're doing, or recruit more partners in the community to help us, or talk to the schools and see what's the story that we're not seeing something that we were hoping to be seeing. Or on the flip side, if something's working fantastically, we'll repeat that and do it more often because we saw what we needed to see faster than we thought. So next slide. Oh, that's just us. So Yeah, that is our logic model. It's a lot. I want to own it's a lot. And what we did when we wrote up the sustainability draft is we put all of the pieces in red that your work groups have lifted up as important pieces that we don't want to lose as far as strategy and activities. And it's in there, and we want to hear feedback from you today about what you see. So I really hope you do open that link and take a look at it. And then we'll talk in our breakout rooms about what we think needs to happen around that. I think Von Yi, I pass to you. Oh, there's one more slide there.
It looks like we got a little out of order. Sorry about that.
Nope, that's okay. Just a
More-
few great resources. So
Cool. And more resources. But yes, breakout rooms for Vanya.
Thanks, James. Thanks, Lori. I just want to, again, thank everyone for being here today. And as Laura said, we're going to designate this time for some dialogue in breakout rooms. This is to just gain feedback on the sustainable plan, the logic model, and the measurement plan. Each breakout room will have a facilitator and a note taker to capture the discussion points for these questions. How does your work fit into the sustainable plan and logic model? How will you use these materials in your work? The logic model could be used to drive funding and funding requests. And as we go into the breakout room, we'd like for you to just stick in the chat. Did we capture what is needed to make CHW sustainable in Minnesota? So you'll see a poll pop up. Go ahead and answer that question, but then we'll see you in the breakout rooms.
And that will take me just a second to get launched for everyone. I'm going to stop sharing my screen really quick to help facilitate that.
And once we come back, we'll come back together and get review from your note taker or your facilitator in the group and just have a larger discussion about what was talked about in those breakout rooms.
Okay, and breakout rooms should be launching in just 1 second. Sandy and Tessa, you should see prompts to join the breakout rooms pop up on your screen. Let me know if you need any help with that.
Hi, James. I'm from Breakout Group 2, and we don't have a facilitator.
Oh goodness. Okay. Well, here, let me swing into there. I can help out with that, I think.
Okay.
I was just trying to get everything organized on my side. I didn't realize that we didn't get someone in there. Shoot. All right. Well, I'll follow you in there.
Can you actually let me see if I can figure out how to rejoin.
Actually, I should be able to. No,
Okay.
I don't think I can. Can I move you into there? I can't. No, I think it should. How do we do that?
Let's see.
There
Oh, I
might
got
be
it.
is there a breakout room button at the bottom or
Yep, I
something?
got it.
Perfect. All
Thank
right, I'll see you in there.
Tess, are you there?
Okay. Welcome back, everyone. Welcome back. Well, I think that gave a 60-second warning for everyone to kind of rejoin. So we'll just give it a moment, and then Vani will take back over for overall review and discussion. But I hope that 20 minutes was at least enough to get the gears turning and have everyone thinking. I'll get these slides pulled back up as well. And I also apologize if anyone else ended up without a facilitator in their room. Zoom promised me that every breakout room would have one of my assigned co-hosts put in there, and then that did not happen. So hopefully that all worked well.
All right, we got everybody back here.
I think so. I think everyone's slowly drifting back in. I just confirm we can all see the slide deck back up as well?
Yes.
Okay, thank you.
I don't see it on my end.
Interesting. Let me try. I can try resharing it.
It looks like everybody is back in. We'll give James a couple seconds to get his screen back. There it is.
Awesome.
And so I hope that folks were able to capture some information, but then also have other dialogue if there was time. In our group, we did. And so I just want to call on folks who took notes of what was discussed during their breakout to review in a larger group and have a discussion. Who'd like to go first?
I'll go first.
Okay, perfect. I was gonna say, I was like, go for it, Rachel, go.
Yeah, we had a really great discussion. The things like sort of high level that I think are really important to highlight is that one of our participants noticed that the recommendations they saw on the work group they participated in, they don't remember all of those recommendations. And so just to clarify for everyone, there were recommendations from other work groups that were then put into the work group where they fit best. So the example we had was someone who participated in the funding work group. And there were suggestions from every work group about sustainable funding. So we had a little bit of a conversation of like making sure that we want to have all perspectives included, and we want to make sure that folks that have the deepest understanding of the specific topic, that those are maybe weighted or emphasize more. So specifically, like if somebody is a person who's been billing for CHW services for 8 years, 5 years, 2 years, you know, that their view on that topic may be more nuanced and have greater depth of understanding than a CHW in the field who just, you know, hasn't ever billed themselves, but is very interested in sustaining the funding. So I think that's something that we can all look at. And then the other thing, one other thing to think about is that we want to make sure that none of the recommendations we're putting forward detract from work that is currently being done. And so, you know, everyone on this call looking at these documents that we've posted. And I think at this point in the process, the things that I'm still interested in, really, really want to hear from folks after this meeting, even is if you're seeing something that a recommendation or an activity that would actively detract from work you're already doing to promote CHWs in Minnesota, that's something we need to know so that we can look at that closely. And then I think the other thing we just discussed a little bit was that anytime you're working with this number of broad-based stakeholders, there's going to be different perspectives, and we maybe won't always all agree on every single activity, because folks will have, you know, the example, I'm stepping into my role as an education manager, so thinking about like training community health workers, there's going to be a different perspective from someone who wants to train community health workers as quickly as possible, like an employer, and someone who provides the CHW certificate, like a certificate school. Like they are going to have different perspectives on the best way to train CHWs. And as a group, we want to make sure that we are hearing all those perspectives and thinking about the way that we can move the profession forward, knowing that there's different lenses and different motivations and different backgrounds. So those were we had a really great conversation. I really enjoyed it, but I'll save my specific notes as we come back together, but those were the broad topics covered.
Thanks, Rachel. Who wants to share what was covered in their breakout session next?
I can jump in next. And you'll forgive me, I sort of ended up in a last minute facilitator role because Zoom did not do what it told me it was going to do. So apologies to my breakout room for leaving them leaderless for a couple minutes there. But we still had some really good conversation. Just around, some probably some feedback, and then these might be some shortcomings on my part for my knowledge of the sustainability plan. There's a lot of moving parts in it. But one of the big questions that was asked was from the evaluation side, is just kind of helping understand the intentionality of, who is going to be collecting data going forward, who's going to be collating that data, and then who's disseminating it back out to the wider community. Is that going to be the responsibility of MDH? Is that going to be the responsibility of the Alliance? And I took a leap of faith and I answered, it depends. I think there's a lot of potential one way or the other. We're still going to be working in close collaboration going forward, but I thought that was a really good question, just like a functional question of how we're going to be driving the work going forward. But how the sustainability plan is informing the work, there's I think it always loops back to funding, and particularly there were a lot of questions about billing for CHW care. I think that's the question we're all asking and working on, and I think there's some really interesting work and research being done, figuring out why some groups are struggling to retain their CHWs, why they aren't accessing billing opportunities and everything like that. We had Patty Graham in our group from Health Partners, and she was able to report some metrics that she shared in a meeting just yesterday, where for the people who are receiving care through Medicaid, only 1% are utilizing CHWs on top of that. And that was a figure that I hadn't heard. And it felt very, very stark to me, that clearly there's work to do about both continuing to educate the community, which is the intention of the sustainability plan, educate the community that CHWs are there and that they're a resource, but also, and this is part of the sustainability plan as well, making sure that employers and providers are aware of the access and opportunities that can be there. So very, very good questions there. And then there's one more piece that we were wondering about, which what are the areas for possible collaborations with other partners in all of this work? No one was seeing it explicitly explained in this meeting, and we were trying to give top level overview. So I think that there's more to come on that, would be my guess, but anyone else can chime in as well. And that's my group.
Yeah, thanks. In light of that question, we can all think about within our organizations, partnering with other organizations to apply for funding that can be done collectively through multiple organizations. So maybe one organization is doing work on health promotions, but another organization is doing work on housing. If there's a grant opportunity that assists in that work, maybe it's an idea to look at the logic model and figure out how multiple organizations are able to get that grant funding secured to get the work done. Anyone else want to share from the work group discussions or the breakout discussions, excuse me?
I can share, Vanya, from ours, some of what's been said already, but also how does your work fit into the sustainable plan? People said it fit in sustaining and retaining CHWs, advancing in CHWs and creating leadership positions for CHWs is already happening in some of the organizations in the breakout group, partly because of the plan. Using billing, really getting billing working, and then having confidence, being able to demonstrate widespread confidence in CHW strategies and the CHW workforce and CHWs as an evidence-based strategy. So those were some of the ways that fit into the work. What people were excited about was being able to tell the story and having data, demonstrating impact, everyone taking their part and doing their part well. And then we had extra time, so we asked, will you use this plan and how? And the answers were yes, we'll use it, and we'll use it with the impact model. Yes, we'll use it, and we'll use it to diversify our care team. And yes, we will use it to create replicable CHW models that we can spread to other places. So lots of excitement, lots of good things.
Thank you, Anne. How many breakout rooms do we have, James? I don't know if I'm missing anyone. If I missed anyone.
I can go next, Benny. It's Kristen.
Thanks.
Yeah, thanks. Laura did a great job facilitating our group, and overall a lot of really positive feedback on the recommendations in the plan. Having a champion at DHS was highlighted as a good suggestion. There was a lot of context that was shared on how different organizations and how they see their work fitting into the plan and the logic model. And there was some great ideas. For example, one partner leads a PhDoc group on CHW documentation, and could that group come together, or could that group come together and look at CHW documentation? Is there something that could be captured differently or captured in a different way? Again, thinking about how do we collectively have documentation and then the ability to report on those. So that was a great example of that. Contributing data to ROI calculations. So that was an idea too, is organizations being able to report that to show the impact. I think also people saw themselves using the data that's reported to help them making maybe the business case for decision makers within their organizations, how many people are served, and the outcome data was noted. That might be lagged over time. There might not be outcome data right away, but longer term, it would be people would use the outcome or impact data. Laura, any big key points that I'm missing from our group that wasn't already shared?
Just to really consider the logic model as a tool you can use for decision making over and over and over. And our goal with all of our plans is to keep not just several organizations, but all of the groups in Minnesota working on this aligned in what they're working on, so that we can see gaps and support all the different strategies to get where we're going as quickly as possible. Thank you to everyone. This was great.
Yeah. Am I missing anyone?
Yeah. We had a group of great participants, and again, I was kind of like James. I wasn't prepared to facilitate, but I did, and so you'll bear with me here if you can follow me. So we had several of our breakout room participants who had actually participated in the sustainability work groups, and quite a bit of positive feedback around the logic model. I can see how their individual organizations can plug into a larger statewide strategy, so it's really nice to be able to tie into it. Felt like it's flexible, so it's flexible enough to work around like an individual organization's processes and the way that they provide services, or even the individual community health worker. The evidence-based models have provided a lot of value to the organizations as they kind of roll out some of their own models, and then also have supported some of the financial and payer contracts, or but in a different way outside of the traditional billing, whereas they wouldn't be able to bill outside of just education. Now it's being billed on time and service. And let me see if I can here kind of keep going through my notes. Also being used for other types of health promotion programs. So not just community health worker programs, but other ones. And then thinking about leveraging the models within those programs as well. Let's see. There was conversation around a challenge that, the models are there to kind of provide guidance and consistency and standardization, yet There's always this need for flexibility. So just kind of thinking about that in the future. And then kind of some opportunity areas is to continue to use these evidence-based models to support different patient populations and then expand the Medicare. So within like the 65 plus populations for their health-related social needs. And then ways that they want to continue to participate and stay within the sustainability of the program is just continue to collaborate and then be able to share their lessons and also learn lessons from what the community is doing as well. And I'm sure I missed quite a bit, so if anyone else from our group wants to chime in, but that's kind of what I had.
Yeah, feel free to chime in and add anything that maybe got missed. We'd like to hear about that as well. And then also, too, feel free to chime in on the poll question we had. Did we capture what is needed to make CHW sustainable in Minnesota? Are there any points that you feel are missing that you'd like to add to that? Anyone can feel free to share.
This is Anne. So one of the other things that came up in the group that I was in was just sort of, when we think about this as a plan or a document, are we elevating the activities that could have like really the biggest impact? Because really it's a very comprehensive document, lots of different activities, but there's some really important strategies that could be that they're in the document, but they're kind of buried in a list of 50 other activities, and yet they kind of stand out. And so sort of a question, maybe for everyone, but definitely those, on the team who are working on the document, does the order in which we share the strategies or activities matter? And is there a need to, or desire to go back and filter and actually prioritize and say, well, so for example, in sustainability and sustainable funding and policy, there was a big focus in that group on setting a minimum reimbursement standard. And that being key to solving a wide variety of issues. And so sort of seen as a fundamental aspect of policy. But there are lots of other policy related things right here because it's a policy work group. So I just wanted to highlight or elevate that comment for feedback. I don't know if others have thoughts, but I thought it was interesting to kind of ask those questions of, does the order matter? And are we letting things get buried that should be more prominent because we have so many activities that are summarized?
Thoughts and feedback? The floor is open. We do have a little bit of time. We're kind of ahead of our agenda, so we're wanting to engage in any dialogue about anything that was missed or any comments on what Anne just mentioned.
I'll just jump in quickly. This is Laura from MDH. I love that idea of prioritizing in the document and keeping an eye on what's low-hanging fruit and what's something that's going to be a long game. I think in our group, we talked about the length of time it might take to do certain things is going to differ. And so just to consider that as where we put our energies. Really good idea.
Mm.
I like that idea too of prioritization. And I think that, again, since this is a statewide, sort of a statewide plan that all of us want to contribute to and be part of, I think some of that can be done by those of us internally at MNCHWA and with our partners at MDH who have been working on it. But I also think that can be done within your organization. So if specific organizations or specific groups of organizations have priorities that are included here, I think that's something that can be determined as you decide how you want to engage with this plan and what kind of space you want to be a leader in this plan, because I think that will be different for different stakeholders. And we want this plan to include a lot of things that are priorities for a lot of folks. But I like the idea of folks taking on specifics and really prioritizing them and moving them forward in their own work.
Definitely. Thanks, Rachel. And Kristen Godfrey Walters at MDH put something in the chat. She says, I wonder if this prioritization could also be a part of implementing the plan and or determining how to implement the plan. Perhaps work groups could be convened for implementation and prioritization. I like that idea too. Mm-hmm. Any last thoughts or input? If not, we can move on and I'll hand things back over to Ann.
Sounds good. Thank you, Vanya. Those breakout groups are pretty good, as always. James, you can head on to the next slide. So first of all, we want to thank you all for helping us develop the sustainable plan for CHWs in Minnesota. We think this is a really big step. We're really excited at MNCHWA to have been able to partner with the health department on this work, and really want to emphasize that this is just the beginning. So we've only been, we've been working towards this for the past year or so, right? But as a state, there's so many different elements to implementation, including what we were just talking about and what Kristen mentioned about actually going in and prioritizing and doing some of the work that James, you mentioned your group talked about in terms of which of the different groups or community stakeholders or partners, where do they exactly fit in, and actually thinking through that together, both as a collective, but also within individual organizations. So really thankful to have had your participation over the past couple of months with that. And of course, to the health department for your work and leading up to this, including a big shout out to Laura for supporting and leading the environmental scan. You did a lot of work in a short amount of time, so, and it was very high quality. So we're very thankful to have had that as a foundation to start with. As well as Kristen for helping, us stay organized within the logic model itself and trying to sync up things together and remembering, understanding the history of where the logic model originated and how far we've come since then, and helping MNCHWA just be a good, feel good about participating in the process and how we could engage community partners in this work. So in terms of next steps, there are lots of next steps. We want to continue these groups. Of course, the Alliance has a lot of different avenues that people can engage, but on this plan itself, we want to, at the Alliance, create a guide on how to utilize the sustainable plan, and that guide perhaps will address some of the questions that came up here in terms of next steps and how do we interpret the plan. So the team is excited to work on that. And continue dialogue to inform what that guide looks like. The team will put together an executive summary of the plan and of course provide the full report based on feedback from the work groups previously and on this call specifically. There'll be a logic model published and of course that measurement plan. I think the timeline for that we were looking at in the next couple of weeks to month or so here, trying to hit that end of the fiscal year, end with a big bang for all the CHW work that's been done over the past year. And then before I transition to announcements, were there any, well, I'll open it up. Are there any other announcements that people have before we wrap up the call? Anything that I'm missing or anything that I missed in my talking points here? Okay, great. I won't hold on too long. Of course, send us a shout out if there's something we're forgetting. And so on that note, one final announcement that I had, most of you actually were just talking with someone about this in the group. So most of you by now have seen that I'll be transitioning out of the Alliance and doing some other work here in the next couple of weeks. And I wanted to, many of you have already shared thanks, so I won't go into detail, but I have really enjoyed my time as executive director with the Minnesota Community Health Worker Alliance. I want to say, as part of this transition, give a special shout out to our board of directors. Some of those folks are on this call. Our staff, our team, our contractors that we work with who are experts in the field, colleagues at the state, and I think probably more importantly, CHWs, like Carrie Ann earlier, who shared her story. That's probably been the biggest part of making sure that what we do at MNCHWA stays centered and grounded in what CHWs need us to do in the state as an organization. And on that note, I want to take a minute to have Sunny introduce herself. We're excited to bring her on board as the interim executive director. So Sunny, I'll turn it over to you, or if you can come off mute, do a brief introduction or add comments.
No, I'm just kidding. I love that. Hi, everyone. It's so nice to meet everybody virtually. What a great place to get such a nice feel for the community. And this is amazing work that Anne and the team and the board and you guys have done. And, you know, sometimes I would say sustainability is probably the most challenging part of any project or program. So it probably could be also the most important part. So again, thank you. I'm excited to step in a kind of short-term interim role, but really my role will be to really facilitate continuity until we do find a new executive director. But I know that Anne, on behalf of everybody within this group and across the state, they are blessed, and thank you for your work. And I can say that having, you know, kind of reviewed everything, there's been an enormous amount of work and lifting that's been done in the last year or so. So thank you for that. But I look forward to meeting a bunch of you if we have the opportunity, and if you have thoughts or considerations for MNCHWA, let me know. But thanks for being here and really like kind of making Minnesota what it is. Great reputation across the country as we've heard. So thank you.
Awesome. And on that note, I think we're ready to wrap up this call. Thank you all for joining this afternoon. There's nothing ever wrong with ending a call early. So thank you so much. Let you get back to it. Stay strong, stay faithful to CHWs across the state, and let's get this job done. Thank you. Have a good one.
Thank you.
Yes, have a good day.
You too.
Bye-bye.